Great. Well, thank you everybody for joining us. This is our first briefing in a little while. And now we're getting close to the holidays with Thanksgiving, Christmas, and other holidays. And wanted to discuss the risks related sort of around the pandemic and how you can minimize those and celebrate the holidays safely. As always, just recall that we will be recording this and we'll make the recording available on YouTube. And then if you just want the audio file, we can email that to you.
Oh my God.
So the briefing will focus on how to stay safe during the holidays with the recent surge in coronavirus. And we've got guest experts, of course. And so I will turn it over to my colleague, Alan Wolf, to introduce our experts for today. Alan?
Morning, everybody. Phil, thank you. If everybody could mute their lines until you want to ask a question, we'll do some quick intros and opening remarks, and then we'll open it up. Our expert guests today are Dr. Emily Sickbert-Bennett, an epidemiologist and expert on infectious diseases. As Director of Infection Prevention at UNC Medical Center, Dr. Sickbert-Bennett has helped lead the effort to keep everyone safe during this pandemic, especially our patients and our coworkers. Dr. Crystal Schiller is a clinical psychologist and assistant professor in the UNC Department of Psychiatry. During the pandemic, she has been helping healthcare workers cultivate well-being and resilience. Thank you both for joining us. Dr. Sickbert-Bennett, do you want to kick things off?
Sure, thank you. Good morning, everyone. For many people, I think the winter holiday season is really marked and defined by gatherings of family and friends, and often centers around sharing food and drink together. And this year, of course, we have to approach those traditions very carefully and differently. As we see in our state and in our communities, our COVID cases are at an all-time high. We're carefully watching our hospitals to be sure that they don't reach capacity. And COVID transmission won't halt for the holidays. In fact, many of the features of our loved traditions, like prolonged indoor meals with many households coming together and the inability to wear masks while we're partaking in food and drink together, will only offer more opportunities for transmission. So we really must remain steadfast in our attention to the 4 key prevention strategies: wellness when attending events, wearing our masks, maintaining physical distancing, and washing our hands.
Dr. Schiller, do you want to make a few opening remarks and then we'll open up to questions?
Sure, thank you. I want to start by saying that I think it's really important this year that we acknowledge the surge in cases and understand what that means for being able to celebrate the holidays. So I think it's really important to start from a place of acceptance that this year is going to be different and reflect on what makes the holiday special for your family, and then try to make a plan to emphasize the things that make the holiday special for you. So for example, in my family, we all enjoy cooking Thanksgiving dinner together. And so this year we're going to be doing that in a different way on Zoom and cook and spend the time, socializing in that way so that we can all be safe. And then I think it's also important to emphasize self-care during this time, that we can recognize that the ongoing pandemic is causing stress for people. And so making sure to take care of yourself and making sure that your own needs are met and that your kids are getting their needs for socialization and other things met as well, even though it might look different from how it usually looks. And then finally, I think one of the things that has been most helpful to people managing stress during the pandemic is developing a practice of mindfulness. And so that's just the returning of attention to the present moment again and again, because oftentimes when we're feeling anxious or stressed, our thoughts are about the future. And so retraining ourselves to be able to focus on the present moment can be really helpful.
Thank you both. I can't wait to see what kind of traffic there is on Zoom on Thanksgiving Day, Christmas Day. Media representatives, if you want to ask questions, just take yourself off mute and fire away.
Hi, this is Judith over at CBS 17.
the CDC came out with some guidance, and some of the things they're saying is bring your own utensils to serve food, or bring your own food if possible. You know, those are the kind of things that we don't usually see on Thanksgiving. Are those kind of recommendations realistic, and how much, I guess, faith do we have that people will follow those?
Yeah, I think it's an important point, and there are a lot of prevention strategies out there, and it's really important to just return to the key transmission routes that we know are the primary ones for COVID-19, and that is really close contact with others and droplet transmission. So certainly spending time together, sharing a meal presents lots of opportunities for transmission. Probably more importantly than the actual touching of a serving spoon after someone else is being shoulder to shoulder and sitting for a prolonged period at the table without a mask on. That's how we've seen transmission occur from the beginning of the pandemic, and it's really more of a concern to get together a large number of people for a prolonged period of time indoors where they're not going to be wearing masks.
Members of the media, just jump right in and ask your question.
I had a quick question. Dr. Cohen, and this is part of the state guidance, recommends getting a test in advance, a couple of days in advance before you go to someone's home for the holidays. I'm wondering if a negative test might give people a false sense of security. And second, would it be better to just recommend everybody who's going to be at that event to be tested? I mean, isn't that the safer course?
So it's an important topic to discuss, and this is a tricky question for sure. I think the first thing to realize is that testing is not a prevention strategy. It's an early detection strategy. So even if you do have a negative test, it absolutely does not negate doing all of the other prevention measures that are important. Wearing a mask, physical distancing, avoiding crowds and in indoor areas, washing your hands frequently. And a negative test only gives you information about a single point in time, and it does not mean that you will remain negative after that test. And so this can be very worrisome, and we certainly have seen instances in the community and in the hospital setting where a negative test has given individuals a false sense of security, and they've not paid attention to the onset of new signs and symptoms, thinking I tested negative 2 days ago, this must be nothing. So it is definitely a tool that we have available to us, but I would caution everyone from using that as a substitute for any of our other prevention measures.
Hi, this is Jason DeBruin with North Carolina Public Radio. Maybe sort of a, I don't know, psychological question, I suppose, but in any normal year, so any non-pandemic year, politics, generally speaking, you tend to avoid those if you know that you're going to disagree with your families, but you can talk about sports or the ham, or there's any number of other things you can talk about. Of course, with some of the protections against the coronavirus having been politicized, you're sort of introducing a very real danger, a health danger that some people take more seriously than others. Do you have any recommendations for, how people can approach that if they feel like they're being more cautious than perhaps some people in their extended family that they do want to spend time with over the holidays, but are concerned that they're not taking the right precautions?
That's a great question, Jason. I think a lot of people are really concerned about negotiating safety precautions with family, especially because of the heated political climate. This comes up in almost all of my sessions with patients in the past couple of weeks. So I think there are a few key points when negotiating safety precautions with family over the holidays. I mean, I think the first step is really to describe very clearly the situation as you see it. So to be able to say, you know, the cases of COVID-19 are increasing around the state, and I've heard a lot about making sure that we're keeping ourselves safe during the holidays. The next step is then to say how you feel about it. So I feel a little anxious about getting together, knowing that we could be putting ourselves at risk. And then the next step is making a specific request or saying no. So for some people, this will mean saying, you know, I just don't feel comfortable getting together this year, given everything that's going on, and all the recommendations suggest that getting together for the holidays is really unsafe. Or it could mean making a specific request like, I'd really like for us to get together outdoors and at a distance this year, and maybe not have the meal together or go on a walk. There are lots of great trails around North Carolina where people can, you know, spend time together at a distance. And then the final step is the one that people often forget, which is to reinforce that. So basically to say, I feel really confident that we can find a way to spend the holiday together so that everybody can feel comfortable. And I know that's important to you too. And so it's this 4-step process of making a request, but it sets you up to do it in a way that is likely to be received well and complied with by family, even if they disagree.
This is Judith again with CBS 17. Another, I guess, psychological question. The pandemic has been very isolating for a lot of people, and maybe they were hoping that by now they could get together with some family and get together with friends or with anyone, and they're, you know, feeling that they're going to be alone again for the holidays. What are your concerns about that, and how can people address those feelings of isolation and loneliness?
It's a great question. I think people are feeling incredibly isolated and lonely during this time. All of us had hoped that things would look much better by now, and they just don't, unfortunately. I think the social isolation and also just the lack of a clear timeline is really weighing on people right now. So I think it's important to have a plan in order for people to feel connected with others. And so that will look different depending on the person and the relationships that they have. And so for some people, planning Zoom coffee hours or lunches can be really sustaining. For others who are maybe sick of being on Zoom all the time, making a phone call to a friend, texting with family members. My boys really enjoy FaceTiming with their grandparents in the evening before bed, and I know that that helps their grandparents feel connected as well. So I think it just depends on the relationship, but I think we all have to be really intentional about maximizing our connection with others right now, because we know that social connection is what sustains us. It's important for human beings to feel connected to communities and groups of other people, and it protects against depression and anxiety. So I would encourage people to be really intentional about finding safe ways to connect. And like I said, even taking a walk outside at a distance does seem to be a safe way to connect right now.
Hi, this is Sarah Hall. I do the Go Ask Mom site for WRAL.com. What is the perfect outdoor gathering look like for you? I think some people might let their guard down and think they can be side by side next to each other, or they think that a screened-in porch is a safe place to have a meal instead of, you know, their dining room or something like that. What does the perfect outdoor gathering look like right now?
So the main risks that we know, the main factors that we know that increase risks are the number of people involved, the amount of time that you spend, and the spacing, both distancing in terms of feet distance, and then indoor and outdoor space, and then your ability to practice prevention strategies. So just holding it outdoors, I think, does not negate the importance of really thinking through carefully what's the right number of people, certainly making sure that you're adhering to all the state guidance on number of gatherings, but a number of people at a gathering. But even the lower the numbers, the less risks, the less contact you have. Spending shorter amounts of time is safer than longer amounts of time. And then also continuing to adhere to those prevention strategies. If you're not actively eating or drinking, keeping your mask on, even in an outdoor space, is much safer than not wearing your mask.
Hi, this is Celeste Gracia, also with North Carolina Public Radio. I'm wondering, does North Carolina typically see a spike in infectious disease cases linked to the holidays, linked to Thanksgiving and Christmas each year, like in a normal, quote unquote, normal year? For example, a spike in cases in the flu?
Yes, our typical flu season, the epidemiology of flu is that we usually see our peak. It varies a little bit from year to year, but somewhere between December and February. If it's already circulating in the community, certainly we see it quickly take off after holidays, Thanksgiving and Christmas. If there's already enough of it circulating in our communities, that's a time when we see increases in influenza, respiratory syncytial virus, some of the other respiratory viruses. This is very common. And then in the winter time, we often see outbreaks of norovirus, which is sometimes referred to as 24-hour flu or winter vomiting disease, and those are often linked to gatherings and get-togethers, sharing food.
And a quick second question, which might be more for you, Alan. What guidance is UNC Health giving their staff, if any? Are there any concerns about staffing if nurses and doctors, well, obviously they're going to take a lot of precautions, but if nurses and doctors come back after the holidays and they need to quarantine, like what guidance are you giving them in terms of traveling or what they should or shouldn't be doing for the holidays?
I'm happy to take that as well. At this point in the United States, the risk is pretty uniformly high. So the act of traveling itself is probably not an independent risk factor as much as what people do when they get where they're going, or even what they're doing when they stay home. So we do continue to message to employees how important it is that they pay attention to all of these factors that increase risks, that they adhere to all of the prevention strategies in the communities. We discourage work-sponsored functions where employees would get together in person to eliminate any of those risks. And then we are very robust in our wellness screening of employees, and any employees who have signs or symptoms that are concerning are immediately referred to occupational health for further evaluation, or if they have a known exposure to COVID, they are also referred to occupational health and put out of work for the incubation period.
Hi, this is Josh Zach with WPTF Radio. Thanks very much for doing this call. I have two questions. The first one being, the flu season has been prognosticated to possibly be lighter this year because of the lockdowns that we saw in Australia. They didn't see as much outbreak there from the flu and people wearing masks. Are we expecting that to happen in the U.S. as the flu season starts to progress? I know that North Carolina doesn't really see its peak until January, February. I'll let you answer that before I ask my next question.
Yeah, we certainly do hope so. And as you said, we watch carefully what's happening in the other hemisphere to help give us some prediction of what we're likely to see this flu season. Obviously, flu vaccination has been a high priority for us among our employees and certainly in the community as another really important strategy we have to prevent flu cases. But the good news is that all of our prevention strategies for COVID-19 are also prevention strategies for influenza and the other respiratory viruses. So if we do adhere to them very carefully, we will certainly reap the benefits in more ways than one.
My second question is related to basically kind of advice that you would offer to somebody who is not wearing a mask, or people have a history of being in that group of non-believers, or they just want to do what they do. Everyone's going to be an individual. The smart people will just stay away from those types. But the main question has to do with the common sense advice of something I actually heard a scientist say brilliantly in a way that was one of those layman's, anybody can understand this analogy, is some people not adhering would be like opening up a peeing section of the public pool. And that really hit me. I heard it months ago, and it still makes a ton of sense today. I didn't know if there was another way of putting it that could make someone who's not masked up before give it a try.
Yeah, I have heard similar analogies, and I think that can certainly be effective for people to understand how much their behavior could impact others in a very meaningful way. I do think when people are reluctant to wear a mask, it is important to make sure that they understand the why behind it. And I know that from time to time that hasn't always been as carefully communicated to the public as it could be, but there are, at least in my mind, at least three main reasons to wear a mask. One is that it protects you from other people who could be ill or even asymptomatic. It protects others from you if you are asymptomatic or if you're symptomatic and out around others. And then thirdly, it covers your nose and your mouth. So all of these concerns about touch transmission and surfaces being contaminated, in order for you to become ill from any incidental contamination you pick up, you would need to inoculate your nose or mouth with contaminated hands with a high enough dose of virus to make you sick. So keeping a covering on your nose and mouth is another barrier for protection.
Could you talk a little bit about the holidays coincide with a lot of college kids are finishing up their semesters. And so what should a college student who's considering maybe going home for the holidays or for a winter break be doing now with an eye toward, going home and that kind of thing?
So I know we already talked a little bit about some of the potential concerns and false sense of security of testing, but I do think certainly if individuals are going to travel and then be in a new area for an extended period of time, one important strategy would be to really be cautious of your activities for the 14 days before you take that trip back home, particularly if you're entering into a household where you have high-risk individuals. The 14-day period before you would travel and return home would be a time period where you would be partaking in much fewer activities, being much more limiting in who you interact with, and that would reduce the chance that you could be incubating an infection when you return back home. And that would give you an entire incubation period before you returned home to family.
Dr. Schiller, as a follow-up to that, do you have any tips for parents whose college kids are coming back home and are dealing with some of the anxiety and some of the isolation, depression?
Yeah, I think, this circumstance is so unusual, and everyone is feeling very stressed, not just parents, but also the students themselves. And so I think being mindful of that and trying to do what you can to support one another, and maybe even asking the question, how can we make this as least stressful for you as we can coming back home. and, you know, trying to figure out if you are going to have the child wear a mask when they return, and whether the parents will wear masks. I think there are tons of different types of masks available on the market now. So find one that feels comfortable to you, that, you know, there are ones that tie behind your head, or the ear loops are kind of uncomfortable. So get some masks that feel good to wear, and that you can feel good about. And then beyond that, I think plan some fun activities that are safe for the family to do together, so that you have things to look forward to, rather than just sort of the anxiety of, you know, having the student come home and potentially bringing the virus home. Trying to think if there is anything else. I think that basically covers it. Thanks.
Go ahead, please. Additional media questions?
Yeah, this is Sarah again, and we've seen a lot of kind of creative ways to visit Santa this year. A lot of the you know, stores and malls are having Santa behind a plexiglass window, and everybody's wearing masks, including Santa, and there's social distancing with the, you know, they're waiting 6 feet apart and things like that. Is that, I mean, how can parents gauge whether that's safe, a good choice for them? You know, I mean, if with all of these, you know, new things they've got going.
I would say that, you know, starting off by really assessing whether or not that's a family tradition that is necessary for you this year. I just chuckle to think about my own experiences with my kids. I think we have some pretty crazy pictures where they're absolutely terrified and miserable, and the opportunity was not for them at all. So adding plexiglass and masks to that picture is probably unlikely to yield the perfect holiday card for you this year. But if that is a family tradition that is really important, I think, you know, making sure that you're wearing masks, you're avoiding crowds, doing all of those things. But I think I would encourage people to think a little differently about how they could do something creative that would still let their child feel some of the magic of Santa without necessarily having all of that interaction in person.
We have time for just a couple more questions. Any more media questions?
Yes, this is Judith at CBS 17 again. So, you know, I think a lot of people are hearing all the recommendations that are out there, but for the people who hear it and think, you know, my family's pretty healthy, I think we'll be okay. What is the danger in that mentality? And what advice do you have for people who think, I think my family's going to be okay. I don't think we have to worry about COVID-19 for us.
I would say that, you know, that is definitely not the right line of thinking as we're approaching our highest numbers yet. Also realizing that some of the highest numbers we had early on were focused in specific populations in our long-term care facilities and in some industry areas. And what we're seeing now in the investigations are that it's happening and occurring in these close gatherings. If you look at the cluster data that the state health department reports, these are exactly the settings that it's happening in. So it is dangerous to think that it can't happen to you, because with the numbers increasing as high as it is circulating in our communities, and it could happen absolutely anywhere.
We are just about out of time. Any final question? If we have one more, we could take one more from our two experts.
Emily, was something that I heard the other day in a faculty meeting that was really reassuring to me, was that there is no evidence of transmission of COVID-19 from one masked person to another, and that in the hospital, when encountering a person not wearing a mask, our staff wears a mask and a face shield, and you can get face shields on Amazon. And so I guess I just found that really reassuring, and I thought that that might be helpful information for others to have as well. I don't know if you agree with that.
Yeah, absolutely. In the hospital setting, we've added eye protection to our masks because that does reduce an individual's risk and doesn't rely on them being around somebody else who has a mask on. And so adding eye protection when you're going to be in a setting where you may not be able to predict other people's behaviors and compliance would give you another layer of protection. I would say that, you know, as Crystal said, as Dr. Schiller said, that, you know, the best mask to wear is one that you will wear and that is comfortable for you and makes you happy to wear because you will wear it. We now know that all different types of masks are very effective. There have been investigations of hairdressers who have been symptomatic and cut dozens of people's hair, and they were all wearing a variety of masks, cloth masks, etc., and there was no transmission occurring. And so we know that, you know, just wearing the mask, whatever mask you choose, just wearing that mask can be so effective.
Great. Well, thank you, everybody. Thanks, everyone, for joining us today. That will conclude our briefing for today. We will make this available on YouTube, and we'll send that link out shortly. And if you only need audio for radio stories, we can email you the full file on that one because it's not too gigantic. So again, thanks, everyone, for joining us. And we'll have more of these in the future. And thanks so much. And that concludes our briefing for today. Thank you.
Thank you, Emily. Thank you, Crystal.